Good day and welcome to today's webinar, Maximizing Dermatology Practice Performance from Data to Insights. My name is Russell Hendrickson and I'm the CEO of Practical Data Solutions.
Hi, everybody. My name is Scott Everett. I'm the Vice President of Healthcare Solutions with Practical Data Solutions, and thankful for you to be joining us today. As we go along, please feel free, if you have any questions, to chat in your questions using the Q&A toolbar. For those of you unfamiliar with PDS, we are an analytics company that is just focused on healthcare, helping our clients become more data-driven in areas of operational, clinical, financial analytics.
So for today's webinar, let's talk about the learning objectives. We're going to touch on, what is paramount for practice success, both with the patient experience and your staff, how quality improvements can optimize time, both in physician schedules, as well as, what are other key productivity metrics we want to take a look at. Really understand the critical role of timely and accurate billing to maximize reimbursement, explore ways to improve better payer contracts, and then ultimately, as we focus in on what makes dermatology analytics and reporting unique, what are the specific KPIs that we need to automate that are not available, and, why it's so critical to look at those things.
So really the idea is to try to help organizations become more data-driven, where it's not just looking at what we think is going on or looking at patterns in the practice. What we're really trying to do is utilize the data that's out there in our systems to help us to make better decisions. We're talking about the data. We're bringing data to meetings. We're utilizing the data to uncover opportunities. And from those opportunities, we're utilizing it to help improve performance and then track how well we're doing in these initiatives that we're putting into place.
And we hear this a lot. The question might be, well, I'm using the metrics and the reporting tools that are available in my EHR, and, the real challenge to that is, dermatology groups have very specific KPIs. There's very unique things that need to be measured. And so if you're constantly just running standard reports or canned reports, you may not be able to, one, automate them, which is time consuming, but two, really make them data driven. Like Scott was saying, we really want to be able to draw conclusions. And so if we can tune our reporting, not only to what's unique in our practice, unique to our dermatology group, but also then automate that, as we'll talk about, then we're really managing on best practice performance versus just trying to get data out as to what went on. And we'll talk about the value of that. But let's dig right in and just talk a little bit about why dermatology is unique and what are some of the unique KPIs that we should be thinking about.
Yeah, so a lot of the dermatology practices that we've worked with recently or that we've been talking to, they like looking at the clinical metrics that are out there and seeing, what's going on with their practice patterns. But a big trend that's going on right now are the retail services that are out there, whether it's cosmetic procedures, whether it's retail medications or creams, things like that. And sometimes they want to break those out. So you can't necessarily do that with canned reporting that's in the system. It requires customization of some KPIs in order to really dig down to a level like that. And I think that's what we're going to talk a little bit about today. What are some of these unique KPIs and what do we really need to focus on?
So as we think about it, we like to discuss what are the cornerstones to dermatology performance and optimizing, both our performance and the patient experience. And so as we think about, we've really targeted, there's 5 key areas. What are the patients, what is their experience? What are they seeing? How do they feel when they're working with us? How are we doing operationally? How efficient are we in moving patients through? Financially, where are there opportunities to both improve performance? How are we doing clinically and from a quality perspective? And then ultimately, even are we taking good care of our employees and making sure that we've got a great place to work, but also that then spills over into the patient experience. And all of that really comes back to being leadership and using data appropriately. So let's dig in now.
Yeah, so there's a reason why patient experience was at the top of that chart, Russell. We found as we worked with a lot of clients that when you put patient experience first and when you center things on the patient, the other stuff just kind of falls into place with it. And so really focusing on what the patient wants and what's going to make the patient happy is really going to drive us financially, operationally, clinically, everything else. And so really what we want to do is understand what our patients are experiencing. We want to understand what they're going through. And the best ways that we can do that is looking at the feedback they give to us directly through patient satisfaction scores, or a place I really kind of like to look at as well that's really critical nowadays is looking at these online reviews that may come through Yelp or Google or Find a Doc, things like that, and seeing what patients are saying about us kind of indirectly, not necessarily giving us this direct feedback that's out there.
Scott, we've spoken about this a few times. Really the question is, what do patients want? And you'd think outcomes, right? They want a good outcome would jump right to the top.
Yeah, well, outcomes definitely is something that you would figure that they want. They're hurting, they have something wrong with them. They want to get that cleared up. But interestingly enough, as you look into these surveys, customer service actually trumps outcomes. How they're dealt with in the clinic, how the people there treat them, are they feeling heard, things like that. That's really what's most important to patients out there. And that's really what's driving these reviews that you see both online and coming back through our surveys. So one of the things that we look at and really like to talk about is online reviews. Social media is a way for people to speak out. And if you are on social media, a lot of times you're going to get more unhappy customers speaking out than you will happy customers. But you really need to understand what they're saying and dig in and see what's there. It's not just about the star ratings, though those are incredibly important, but it's also about what is it in particular that patients are seeing that they're liking? What are the things that they feel need improvement or led to a poor experience with them? And so when you look at it, we found some interesting trends that actually go into healthcare right now is that when patients are looking for a practice, they're actually reading at least 5.5 reviews of each provider that they're looking at in order to select who they want to go to. 84% of these patients will not go to a provider that has less than a 4-star review. And so really those star ratings are incredibly important with what you're trying to get, because a lot of patients, if they see it lower than that, they won't even consider your providers. And of course, like we talked about before, customer service is the key. That's the most important factor that they see. It's not necessarily what the provider's telling them, but it's what they're also experiencing at the front desk and possibly even with the back end in the process that they're working with there.
And Scott, I would surmise for specialty practices like dermatology, it's probably even higher, right? Where we have a choice where we can go. Um, but it's pretty easy too. When you think about what do you see in these, 5-star reviews, what do you read online? These are the common themes you hear. Highly recommend, love the staff, great practice to work with. People are personable, great outcomes, would recommend. People when they say great things and they have a great experience, they're usually very upbeat. So those are the easy ones to sort of follow. It's the other end, Scott, that I know you did quite a bit of research on.
Yeah, I read a lot of these comments, and I went in on the ones that are getting 1 star, and unfortunately I can't unread some of them, but some of the comments that you got, the patterns that you're seeing, the staff is rude, the provider is rude, it was hard to get in. That's really what it gets to. They want to be able to get into a provider quickly and easily, and they want the staff to be kind to them once they do. Other things come in with, lack of privacy, costs are too high. That's actually more rare. What's really important to a lot of these patients that are out there is how well they're treated by the staff and can they get an appointment easily. So if we want to look even more in depth, we can look at the direct feedback that we're getting through these surveys that we're getting coming back through it, whether you're using Press Ganey or CAPS or another survey company that's out there. Getting this data can really give us a lot of insight into what we're seeing in terms of what the patients are telling us. And one of the ways to do that and really is key is we've got to be able to communicate this back to the staff and to our providers. And the way you would do that is to create a dashboard that looks something like this. You want to highlight the key metrics on the top. You want to make them very noticeable, easy to read, and then utilize color to say blue is good, yellow is bad, or whatever you want to do, but make it easy to understand where are areas where you're performing well, where are areas that maybe you're struggling a little bit.
Yeah, and we'll talk about this, not just only looking deeper into what the patients are saying and make sure we're communicating that effectively, but also then how do we blend this data in when we start looking at productivity and financial performance, right? Because we could have great financial performance, but we might not be getting great reviews, which ultimately, again, as specialists, mean patients aren't going to come back. They're not going to recommend, and you're going to see that downward trend where it's harder to get patients in the door. So really critical that we're looking at these kind of things and making the data really pop. That's the value of dashboards. And we're going to talk a little bit more about that as we move forward. The other two key areas of patient experience, though, and we saw this in one of the reviews, is patient billing, what the patient sees afterwards. They may think their insurance is going to cover it. Maybe they do, maybe they don't. So, having a good experience and making sure that if they have a problem, they can get somebody on the phone to help them. Really see a lot of that in the reviews, that patient billing can be very confusing at times. The other area too, and more organizations are doing this, but in a dermatology group, I think it's critical is to look at, if you haven't, your in-clinic wait times. How long are the patients waiting from when they come in, or how long are they waiting in the exam room, or do you some days run behind? Really critical that you're monitoring that. If you don't have a way to do it in your EHR, you may even want to just do it with a clipboard on a few key days, especially when you're busy, and making sure that you're mindful of those wait times. They can be really critical metrics.
Yeah, and actually that leads into what we want to talk a little bit about as well as operations. And particularly we're talking about patient access here. We want to look at maybe some patient KPIs, look at, what are the providers doing in terms of procedure mix and ancillary services that you're providing. But really what we're talking about here, especially when it comes to maximizing patient experience, is optimizing your operations and particularly the scheduling and patient access.
So one of the biggest areas you'll see in your patient reviews, if you're not aware of this, is how easy is it for the patient to get in? They've called, they've asked for an appointment. So we obviously want to be looking at things like, what's the appointment lag from when they called to when they're going to be seen? Do we have a lot of cancels or bumps or no-show appointments? Those are things that could be impacting. We may be blocking times for patients, but then if we're not filling those times or the physicians are bumping, can have a huge impact both on satisfaction but also on productivity, right? And then of course looking at things like book time versus available time, third next available appointment. Those are some of the harder metrics to get to. But let's take a look at a visualization and talk a little bit more about how being data driven can really drive to where we're headed. So if we look at a visual dashboard, we can summarize a lot of those key metrics we were just talking about. Some of the things we may want to look at is, what are we doing AM sessions versus PM sessions? Do we have more capacity maybe on Thursdays and Fridays? Do we have a lot of demand on Mondays and Tuesdays? And maybe do we need to staff appropriately that way? Understanding if we have a lot of bumped or cancels. We talked about, how quickly are we getting patients in, looking at things like appointment lag or third next available. And one of the big advantages to having this technology available when we build a visualization is we're not just now looking at the metrics, but we can also quickly point and click and drag and drop and really start to understand, what's going on with our data, because our report or our dashboard is really giving us insights to everything, not just a picture of what's going on.
Yeah, and I think it's really important with something like this, Russell, to be able to get in and look at kind of the interplay between metrics that we're seeing here. For example, you look at the third next available right there, and you can see right away there's a lot of availability within 0 to 3 days, yet hardly any of our appointments are getting scheduled within 3 days. And so you really want to kind of find out what's the disconnect there. Is it a patient demand thing? Is it a templating issue? Also looking at scheduling utilization. Who are our providers who are really underutilized in terms of the schedules that they've set? You may need to dig into their templates to see and validate if that's truly what's going on, or if there really is that much available capacity out there. And if there is, then that's something that you can utilize in order to try to get patients in a little bit faster.
Yeah, the other thing we can do again with the visual dashboards, of course, is we can, cut out metrics and then slice the data, whether it's by location, by, service line, or even, down to the physician, so we can target those metrics to where we see KPIs that we need to improve on. So as we look at scheduling data, we then, may want to look at different cut-ups for metrics that are specific to how we in dermatology want to manage those patients or those cases or those visits or those encounters. Scott, we've crunched data probably 27 different ways for 27 different practices. Guide us through a little bit of this.
Yeah, everybody seems to have a little bit different definition of what they want to look at in terms of visits or encounters, and do they use them interchangeably, or does a visit mean one thing and an encounter mean other things? A lot of the patterns usually that we see is a visit typically is defined as one patient, one provider, one data service. That's where it comes in. An encounter may be multiple providers that they're seeing in the same day, but it's still one day that they're seeing. And so that may be a couple of encounters, or maybe just one encounter. And then cases involve certain CPT codes. So you're looking at maybe surgical cases or episodes of care in that way as well. That you look at many dates of service, you may look at key diagnoses, things like that. And so really it's important to be able to customize these metrics within their system to be able to track them in the way that is most meaningful to your practice and the way that you want to do business.
Yeah, Scott, I'm always amazed because when I talked with different dermatology practices and we start talking about customized KPIs, we hear just that. Everybody sort of got their unique way of looking at things. And yet, when I ask the question, well, how automated is that? The answer is, well, it isn't, or it's really challenging, or we can only measure it maybe quarterly because we have to run a lot of reports and then somehow manually or kind of crunch through it. So when we think about what are the metrics you're reporting on, whether it's breaking out clinical patients versus cosmetic elective patients, whether it's breaking out the types of procedures or service lines that we have, right? We want to make sure that we're able to measure things quickly and easily with the customized definitions that we're looking for. And then, obviously build them right into our dashboard. So now we spend more time looking at what's going on and looking at the changes in our business rather than trying to just crunch the data and calculate metrics.
Yeah, and one of the things I've really noticed as we've worked with more dermatology practices is they love looking at that new patient ratio and bringing in new patients all the time, because that's really what is going to feed the continuity of their business moving forward.
Yeah. And Scott, that kind of rolls right in. We talk about this all the time, but I think it's just so critical when you think about, as a practice, right? How do we strengthen the bottom line, which is really going to be our next topic, seeing new patients, right? Or seeing more patients. So that's why that new patient ratio is so critical, right? Increasing access so we can get more patients through the door, also growing our business, and even looking at market share for marketing, like many dermatology groups are. Are we actually getting, some bang for the buck of our marketing dollars in terms of growth? Also, then thinking about, the services we're doing, how can we improve reimbursement? Things like coding, looking at denials or payer contracts. We're going to talk about all of those. And then, how do we get paid quicker? And we'll talk about things like, both the mix of patient collections, but also our lags that could be tying up money just because of the time it takes to get reimbursed.
Yeah, so that leads us to the next point that we wanted to talk about, is that financial point where we really want to dig in and see the revenue cycle. And you may have some good reports coming out of the revenue cycle, but does it dig down to the level that you want to get to? You want to look at your payer contracts because you want to understand those and how you get reimbursed. You want to understand how quickly you get paid. And of course, denials is always a huge piece to any practice that's out there, because it's a thing that literally does decrease the reimbursement that they're getting from their payers. And so it's something that they want to make sure that they have control over and prevent whatever they can, but then recover when they're not. And so this is just an example of a revenue cycle dashboard that gives you a quick and easy overview of each of these things, where you can see, again, your charges, payments, and adjustments that are posted in a given month. You can see your average charge lag, how quickly are your providers getting the charges into the system, how long are they are your days in AR, how long does it take to get paid? And then obviously looking at your appointment lags and appointment status trend, helping you to really understand the volume metrics as well as the cash flow metrics that you're seeing while you're out there. And of course, we've got a whole piece looking at denials as well.
Yeah, Scott, just a couple things I want to point out here. Obviously, a lot of these KPIs are, kind of standard things you might look at for revenue cycle, but making sure, we talk about dashboard design for a minute. We have benchmarks in place, targets, goals, and you see quite a few of those here, but also down the left here, this little call out. We just talked about that monthly patient volume, looking at growth of patients, looking at our matched collection rate, and then here's that patient satisfaction metric. Would the patients recommend the group? So as much as we're focused on finance here, we talk about, the core cornerstones, keeping an eye on what's going on with how patients, are perceiving and are they satisfied with the services that we're providing.
Yeah, and of course, a big key that's not actually on this chart, but one that providers and practices are always looking at is RVUs. And RVUs can really be a critical metric because it's how you get reimbursed. It's a measure of your productivity and volumes that come forward. And unfortunately, a lot of times, what you're getting from RVUs out of your billing system isn't necessarily what you need. A lot of times we have clients that have us calculating 2 and 3 different RVUs for them to utilize, some that are different for compensation, some that are measures of productivity, and some that are measures of reimbursement. And so really what you want to make sure that your RVUs are doing, or that your practice is doing, is making sure that you're matching it back to the CMS table that comes back every year, because that again is going to help you understand your reimbursement better. You want to make sure that it's getting modifier adjusted. That can be different at an individual payer level. You want to make sure that you've got the correct RVUs for your contract years, and whatever your contract reimbursement is based upon. You want to make sure that they're accommodating for any unlisted codes or pseudo codes that your practice has that may not be in the CMS tables. And then, of course, you may want to look at different normalization factors for compensation or benchmarking, and looking at significant changes that may come from year to year through the CMS tables, or looking at things that may come out during the year to these CMS tables as well. And so keeping up to date on RVUs is really kind of a big thing, because RVUs can be very, very telling in a lot of different ways.
So, Scott, you mentioned RVUs, and yet I've heard a lot of times dermatology groups, like some of the other specialty groups, that have that more eat what you kill kind of model for compensation and reimbursement. And so, they say, well, we don't use RVUs, or we don't really look at RVUs. But I think it's critical, and I'm sure you're going to agree here, that when we start looking at our contracts, it's so important we understand what's going on with RVUs. It's so important for many different reasons, which includes what happens every January when CMS rolls out a new fee schedule. Can you walk us through a little bit more of contracting and how RVUs tie in for understanding changes in reimbursement?
Yeah, I mean, a lot of times your payer contracts can be tied to an RVU conversion factor. And even if they're not, I highly recommend that you go in and calculate one at a high level, just so that you can benchmark your payers against each other in terms of what's the reimbursement that you're supposed to be getting versus the reimbursement that you're actually getting. I actually recommend that you also look at your denial rates, because you may have a very high contract conversion or RVU conversion factor. But if you have a high denial rate as well, that has to be factored into the performance of that payer and what you need to look at in terms of negotiating your next contract with them. In addition to that, we want to look at things like underpayments. Are there CPT codes that are in our contract where our payers are not paying what is in the contract, and we need to understand what those are and recover those as quickly as possible. And then, of course, looking at time to payment, how long does it take to get paid from each individual payer? How much are we getting paid, with our denial rates, and how long is it taking when a denied claim comes back? How long is it taking us to be able to appeal that and get it back out? So again, we would look at payers the same way we would look at the practice. We want to look at cash flow and timeliness to payment. We want to understand reimbursement, and we want to understand volumes.
Yeah, so Scott, let's just dig a little bit into that time to payment, right? And why there's oftentimes cash tied up.
Yeah, so time to payment is a big deal for cash flow purposes. You can go out and you can bill as much as you want, but you can't turn a receivable into cash until the payment actually comes through. And so you need to understand where in your system is your cash being tied up. Is it in the front end? Is it taking a long time to get your charges into the system? Is it taking a long time to create the claim and send it out? Is it taking a long time to get paid? And then once we do get paid, how long is it taking us to follow up with the patients and collect on any co-insurance or deductible information that we didn't get up front? So all of these factor into your getting cash. And one of the things that I always like to talk about is that if you can take one day off of any of these, then it's like collecting 366 days of payments that year rather than 365. So of course, if you take out 5, 7 days out of your cash flow pipeline as well, it can really be a substantial cash improvement that you'll see it hitting your bottom line at the end of the year.
Yeah. And just like improving our cash flow, Scott, you talked about denials and the impact of denials. If we can reduce the amount of denials, we're going to get paid quicker. Average claim denial rates run 5 to 20%, across practices. Statistics show us, yet only about 1 out of every 3 denials are appealed, which really is mind-boggling. And so, let's talk about denials now and the impact denials have both on cash flow as well as on practice reimbursement.
So one of the really critical things to understand about denials is we need to know every single month what's getting denied, why is it getting denied, who's doing the denying, and we want to start looking at sources and things like that so that we can put strategies in place in order to mitigate these denials and be able to prevent as much as we can. So one of the things that we like to look at in these volumes is looking at the trend of denials over the month, and we want to match those so that we can get matched denial rates. And that's what's going to tell us if an increase in denials is because of an increase in charges or if it's a function of something different that we need to make sure that we're addressing immediately. In addition to that, we want to know why these claims are being denied. And so we want to categorize our denial codes to understand, is it an eligibility issue, a registration issue? Is it a issue of duplicate claims or an issue of documentation, or is it something on the back end of the payer processes and non-covered services? We really want to make sure that we understand, again, who's denying, why are they denying, and how much are they denying every single month.
Yeah, and denials is such an area that we could spend 2 hours just talking on that, but I'm going to kind of accelerate right ahead to not only do we want to understand where and why we have denials, as Scott was just talking to, but ultimately we want to understand when those denials occur, are we ever recovering them, right? And so if you look here on this visualization and we start to hone in on these are denials that have a lot of revenue associated to them, but less than 20% of the time are recovered. And so by having good analytics, having our data lined up, we can quickly see that we've got challenge here at this particular location. We've got challenges with different payers or, some of the things that we're doing and even, what are the types of codes that are getting denied? Because ultimately we can project because of these denials, if we don't collect them, that's how much money we're going to lose. And if we do collect them or if they're written off, that's how much we lost, right? So we can look at what's open in our denials and understand the impact if we don't do a good job collecting them. Or we can look at how much we lost looking back historically over the last 12 months and saying, we got these denials we were never able to recover. So denials playing really a key role both on profitability and strength of practice, but also can create a lot of time consuming and operational challenges for follow-ups.
So while we're in this finance topic, again, we wanted to talk about what we talked about a little bit at the beginning of the webinar, and that's that a lot of dermatology practices also offer cosmetic services as well as retail products. And in looking at that, they may want to track that because that may be higher margin services and higher margin profits that are helping with the bottom line. And so they want to understand the trends that are there. Of course, we want to make sure that we're providing the customers what they want in terms of these retail procedures, but at the same time, it's really important that we focus in on our clinical quality as well. So being able to look and see the balance between the two can really be helpful in making sure that we have a proper balance in our practice.
Yeah, and that really aligns with then that fourth pillar we talked about, which is understanding clinical, how we performing clinically, how are we performing with outcomes, how are we performing against, what are some of the key payer quality metrics that we might be measured on or we might start seeing as part of reimbursement, and ultimately even looking at our, quality in terms of any of the specialized services that we might be providing.
Yeah, and so one of the ways that you want to look at that is quality can be a difficult thing to measure. There may be specific things that you want to look at, but if you're wondering where to start, there's already a set of metrics that are out there in terms of the MIPS scores. And so being able to look at MIPS scores that pertain to your particular specialty and understanding how each individual provider is performing with these MIPS scores, finding which providers are meeting the goals in terms of the quality goals that are set, and how many providers are lower than what we would expect or what has been set with the different metrics that are out there. And you can look at 8, 10 metrics that pertain to what you're trying to look at, but really understanding how many patients are eligible for these MIPS scores that are out there, and then looking at understanding how are we performing as a practice and how are our providers performing to these particular metrics that we're looking at.
Yeah, Scott, and you point out a couple of key things. Obviously, we talk about reimbursement payer contracts. If the payers for your, particular practice, dermatology practice, are, have some focused quality metrics on how you're performing, I would want to see those, focused front and center on any of the quality dashboards that you might be performing and maybe even integrated right into your physician dashboards. One of the other sort of design features of this dashboard, is that it's only highlighting the physicians at the bottom of the screen. You see only the names of the physicians that are not hitting their clinical or quality targets. So it really makes it easy to sort of understand where we may want to provide more focus. And, speaking of physicians, then that leads us to the fifth pillar we talk about, which is how are we doing with our employees? Are employees engaged? Do we have a lot of a turnover? Are we able to recruit the kind of, staff and talent that we need to keep our practice healthy and growing? Are we educating our physicians? And even then, we talk a little bit about referring physicians, even though they're not employees, sort of put them in this category because it's critical that we are also thinking about and how are we taking care of the patients that are being referred to us to ensure we're keeping our referring physicians happy and satisfied with the quality of care we're providing to their patients. So, studies have shown time and time again that when employees are engaged and have higher engagement levels, it has a direct impact on the patient experience and how satisfied patients are. And of course, better outcomes with patients means, increased growth of the practice, more recommendations, and ultimately increased financial margins. So how are some of the things, Scott, that a dermatology practice might want to look at? What are some of the KPIs that we might want to look at as far as understanding employees and good outcomes with employee engagement?
I mean, obviously, the best way to look at it from a metric standpoint is that you can engage with a employee engagement survey to get the individual scores that you may be looking at. But if you're not going to do something like that, there are a couple of key metrics that you can look at in terms of maybe disciplinary actions taken during a month. You can look at recruiting costs, things like that. But really, the one that I really like to look at that is very telling is your employee turnover rates. Employee turnover rates is a cost that a lot of practices don't really understand because it costs a lot more to recruit, train, maybe give upfront bonuses to a new employee than it is to keep an existing employee. And so looking at these turnover rates can really be helpful in terms of making sure that your engagement is high and helping to identify problems as they pop up.
We also mentioned, having good metrics on what's going on with our referring physicians and again, good data analytics makes it easy to understand who are the referring physicians, how many charges are they referring to us, or how many patients are they referring to us? What are the services being provided to those patients? So, having good data, having good analytics makes it easy to, point and click and really understand what's going on within the practice?
So I think it's really important to understand that there's a lot of ways to communicate this data and a lot of ways to put together these reports, and what's the right way. It's whatever's right for your practice. But really the key is to understand the components that go into being more data driven and communicating this data out. You have at the very top a visualization layer, which is something that you want to be able to show in order to digest information quickly see trends, quickly notice patterns, both positive and negative, and be able to ask questions. What's leading into that? That should take you into a slice and dice OLAP cube where you can go in and you can do quick analysis that returns results almost instantaneously. You can apply filters and you can really dig in to understand the whys of your data. And of course, you want to be able to move seamlessly from that to the detail level information, invoice level, patient level detail that's out there. And being able to move back and forth between these can really be a good key for your organization. And of course, a lot of tools out there in the market do this. What's really important is that optimized data that's sitting underneath whatever tool you're utilizing.
Yeah, so Scott, let's dig into this because we spent a lot of time talking about dermatology KPIs, the metrics that we want to be measuring, but let's spend just a minute and talk about some of the technology, right? So, visualization software is very popular. Power BI, Tableau, these almost have become household names, right? And so the value of having visualization software, as you mentioned, is to be able to understand and communicate data quickly, right? And that's what's so great about the visualizations, or even, whether we're using more what we call static dashboards. But let's take a look at how does all of this play out, right? So let's sort of just walk through at a high level. This is a great example where, we're looking at things like RVUs by physician against the benchmark. We can start to understand, who's performing, where are they performing, how many charges are we doing, or how many procedures, right? But then we start to think about where do we have operational improvement, looking at that coding lag, or looking at how quickly are patients coming through the door if physicians aren't performing, whether we're measuring RVUs or just revenue being driven into the practice. We could start to then understand and bring in scheduling volumes along with our RVU volumes, along with our coding, right? All the things that start impacting RVUs. A good visualization, though, allows us to go further. Now we want to look and we want to see, well, we have these high producing physicians, but how many of them have very low, patient satisfaction scores, and being able to tie all that data together that we've just been looking at. Ultimately, then, when we tie all this together, because we're using this visualization technology, Scott, as you pointed out, it's not just a visual. We can go from a visualization, drill into the data, and then very quickly do analysis, what they call OLAP, as you mentioned, Scott, that OLAP cube that makes it easy for me to point and click and drag and drop and really understand. It's not very pretty and it's not meant to be, right? So we can start to understand what services are we performing where, and get even all the way down to what physicians are doing what services and where are they doing them. From this quick OLAP analysis that we could continue to change and do analysis, though, let's drill into the charges driven by Todd Allen. And very quickly, I can go from visual dashboard down into the cube and all the way down into the patient level detail. We're looking at the various services provided to the patients, what the charges were, what the payments were, and how we've been collected. So it makes it very easy for us to have not just a visual dashboard, but all of the metrics and even down to the patient and the detail all in one place. And that's what we're talking about when we talk about having good data and good analytics, that we can literally explore data and get answers quickly.
While we're talking about employees, we need to understand that our providers are our employees as well. And provider compensation is one of the big things that practices come to us with in terms of being able to automate reports and communicate compensation back to the providers. And when you look at it from the standpoint of productivity, quality reporting, as well as compensation reporting, those really shouldn't be silos. Those should really be things that are reported on together, reported as one, and give the provider everything that they need in order to be able to self-manage the way that they practice and be able to maximize their compensation while also understanding their level of quality and access and patient satisfaction that they're receiving back as well.
And so, Scott, even if we look at sort of a kind of typical standard physician dashboard, right? And even something that might be done in Excel, like the example that we're doing here. If we can provide that data, provide some context, but ultimately, when we start thinking about compensation reporting, right? It's great if we can tie those same metrics that we're showing the physicians every day or every week on how they're performing. If we can help them understand the trends in their production or where the patient satisfaction is increasing or decreasing, as well as how it ties to compensation. And ultimately, what this means is we want to make data meaningful and available and timely so we can really understand and manage what's going on. Okay. As we continue to talk about data and analytics, since we're talking more technology now and the ways to put data together, let's just quickly look about the levels of what we call analytical intensity and how we can use data to be more data driven, which, Scott, is where we started with this, right? So it's not enough to just trend data. Here's your production for the last 12 months. As we've talked about, having good benchmarks so we can understand how are we performing, whether we're using internal or external benchmarks. Ultimately, then being able to blend the data to understand our patient satisfaction, our operational production, where we have gaps in our performance. And as we're going to talk about coming up, how we can project data. But Scott, walk us through benchmarks and the importance of that, because without benchmarking, we can't project outcomes.
Yeah, so benchmarking really can be key in terms of giving context to the metrics that you're communicating out to your staff and your providers and your executives. And so one of the reasons why we benchmark is we want to be able to look at our internal goals and be able to set those at a reasonable standard. Now, there's a couple of ways that you can benchmark. One, you can utilize internal benchmarks, and that's just comparing people and locations and payers within your practice themselves. And that's a good way to set organizational goals to help us look at, where we want to be from the standpoint of our patient satisfaction scores in terms of utilizing budgets and where do we want to be that way and how are we performing as compared to a budget, and then looking at individual targets for productivity, medical wellness visits, things like that to really compare providers against each other, and looking at departmental averages that way can be a very compelling way to look at it. You can also look externally, and you can look to other organizations that put together, RVU productivity benchmarks, compensation benchmarks, maybe even some revenue cycle benchmarks that are out there. And so you can benchmark that to show how your practice performs against others. There are good sides and bad sides to the external benchmark in terms of the calculations that they use. Are they the same as yours? Is there regional bias? But really, if you're trying to become a best practice organization, what you want to do is utilize external benchmarking to understand where you fall within the market or nationally as a whole. And so both can be very useful to you in terms of communicating out these metrics.
So, what is performance opportunity and why are these benchmarks so critical? And a great place to start is internally. And just, to share just a little bit on this, if we have, 8 providers and we compare them, whether it's on revenue driven, patients seen, but we're looking at any kind of a productivity metric, right? If we stratify them, the highest to the lowest, and then we say, if we could move these bottom performers up either to the median, right, or just increase their performance, even our top performers, if we can increase, seeing a few more patients, minimizing wait times, increasing patient satisfaction, cutting down on the time it takes to bill the charges, if we could just move any of our KPIs up. And so how does that apply? And we just talked about the levels of analytical intensity. And so let's take a look at that very specifically and say, well, let's go back to the patients, right? And looking at our patients. And so if we look at the number of patients seen per session, and we look at the bottom, these are the physicians that are seeing fewer patients per session. These are the physicians that are seeing more patients. And if we could just move these bottom lower physicians, the ones below the average, up to the average of the performance, we can quantify the projected performance increase by moving the bottom performers up. What's so neat is you can do this with payers. You can do this with front desk registration. You can do it with checking patients in. You can do it with, really any metric in your organization. How are we performing? And what if we could increase in that performance? And so it's just something to think about. This is an area that we talk a lot about, which is using data not only to improve, but then to quantify the performance improvement, which ultimately helps us drive better outcomes. Um, and so it's really kind of an interesting thing. And certainly we'd love to talk with you more about how we could help you do that.
Yeah, I think the biggest key though is that we need to take this data that's out there and we need to communicate it better to everybody that's out there. I know a lot of times we look at what's going on and managers can be very overwhelmed because we have to manage our provider productivity and make sure that they're seeing enough patients and bringing in enough revenue in order to be financially feasible. But at the same time, we have to balance our patient satisfaction and our access, and looking at all of these can really be overwhelming. But again, what we need to understand is these shouldn't be silos. These are all part of one great whole. And so when we look at it from this standpoint and look at the overlap, really what we come to the conclusion of is every time you put the patient at the center, you're going to be more productive. You're going to have better financial success. You're going to have better access, and your patient satisfaction is going to be higher because you're focusing on what's important, and that's the patient. And once the patient is taken care of, everything else falls into place.
So I challenge you, you watch this webinar. We've shared a lot of insights. We've shared a lot of information. Certainly hope it's been valuable to you, but I challenge you to look at the different aspects of your current analytics and is it meeting your needs to effectively manage and run your dermatology practice, right? And so, think about access to metrics. Do you have the access to the metrics you need and can you get to the reports or the KPIs quickly? Within your reports or dashboards, do users have the ability to drill down if they see an anomaly or they see something within a report and they want to dig deeper? Second is, does management have, the access to all of the different metrics? Can they look at the big picture? And do your dashboards communicate those performance gaps? We've set a target to have no more than 11% denial rate, and yet we're running at 14 or 15. Does that jump right out in your dashboards and make it easy to understand there's a problem that needs to be addressed?
Yeah, and really, again, what we want to look at is we're trying to increase performance, we're trying to increase productivity. And in order to do that, the consumers of these reports have to understand the metrics. They have to understand what their targets are, and they have to be able to understand what they need to do in order to be able to meet those metrics. And of course, one of the big performance metrics that we look at is the physician compensation itself. And so we want to make sure that our compensation is aligning with our organizational goals, as well as maybe with different payer contracts that we have in place. And of course, it's important that this information is shared in a timely fashion. Ideally, people have self-service access to metrics, but if not, these reports should be automated. They should be delivered at a regular basis. And of course, they need to be distributed out in an automated fashion quickly and easily so that people can look at the data, they can take the data into what they're trying to manage to, and of course, then they can make the improvements as they see fit.
So we've covered a lot of ground today. We've covered a lot of material. I thank you for joining us. When we think about these five cornerstones, patient experience, operations, finance, clinical, and our staff, our employees, if you have gaps in your reporting, if you're not able to access the information you need, if you don't have the visualizations you need, or you're struggling with how to put it together, certainly encourage you, reach out to PDS. We'd love to talk to you, whether it's a little project or a little bit of insight. We may be able to help. We have a lot of different solutions and we work with organizations, sometimes a very limited scaled fashion, or something that really could help across the whole organization, especially if you're growing. One of the biggest challenges is keeping up with the reporting needs of a growing practice. But we certainly encourage you, to take a look and love to learn more about what are some of your reporting challenges and to share how we might be able to help you. So with that now, thank you for joining us. We're going to take questions live. We'll continue to take questions live. But I also do encourage you, you can certainly reach out to us and, we'd love to talk further with you. There's more information. And if you've enjoyed today's webinar, we'd love you to give us that feedback so we can continue to improve what what we're doing, but also on our website, there's quite a few different detailed areas. If you're interested in learning more about our denials or understanding how you can better impact denials data, we have a whole webinar that's available on that. Physician productivity, we've got some new webinars that have been put out around those areas. So certainly encourage you to take advantage of the resources that we have, and we'd love to hear from you if we can assist.